I would like to request our experts to be brief because we are really
Okay, the first question was the women issues in these training programs. I'm in the field of emergency care, and we have been partners with programs for gender violence or gender assault because we identify them, and in the Philippines I partner with these groups where we are able to identify them and be gender sensitive in the management of women that have been assaulted, raped, or etc. So because they all come through the emergency department, and we are supposed to pick them up and refer them to the social worker, to the necessary women's group that actually partner with us. So my answer to that question is, the hospital is only as strong as what it does on a day-to-day basis. If on a day-to-day basis they are sensitive to gender issues and gender cases, they would be sensitive during times of disaster. If they're not sensitive on a day-to-day issue, don't expect them to be sensitive during times of disaster. The second issue was the conflict. Conflict is indeed a very big problem now in the world, not only in Mindanao, because we have changed all conventions. Now the hospital and the health worker is targeted. You have someone kidnapped who is a worker from MSF. There is a bomb exploded in a hospital in Pakistan. The health worker is now a target. So this thing is still currently evolving, and unfortunately, although we have programs that talk about how to manage conflict, it is only programs that we've learned over the years in terms of mass casualty management, but not the fact that we need to protect the health worker. So in fact, for the Safe Hospital campaign, we are actually pushing, the WHO is pushing the International Red Crescent and Red Cross societies to actually elucidate again the fact that hospitals must be sacrosanct or must be sacred, and health workers must be sacred in times of conflict, because they will provide care to both civilian and combatants, and even become culturally sensitive. And this is your problem now that you're facing in Mindanao. The fact that the Muslims don't want to go to the Christian hospitals and the Christian hospitals don't want, because this is the root of the conflict. And before, there was the Geneva Convention. If you had that Red Cross or Red Crescent, you will not be bombed or you will not be shot, and you can save people who are injured, especially civilians. Because that has all been thrown out the window, because as you read in the news, that is no longer respected. So we need to proceed as part of this Safe Hospital campaign, some level of agreement among all stakeholders that health workers and hospitals should be sacred institutions that we protect, that will protect people, whether combatant or non-combatant, whether civilian or in conflict. And I think that's the most important. Cultural sensitivity, I have had the most experience in cultural sensitivity because I run programs in Muslim countries, in other, in Buddhist countries, in Hindu countries, so it's very different. So the Muslims would not eat pork, the Hindus would not eat beef, so you have to be very sensitive even with the food that you donate during disasters. Some people would give pork items in Indonesia and they don't eat pork, so these are issues as well. So these are very important issues. Handling of women, very strict in Islam, and then if you don't follow this cultural sensitivities, you again get into more trouble. So I think those issues you raise are all important. As a last note, Ms. Chairman, I just want to propose that maybe our group can actually put in the Manila Declaration something saying that hospitals are being run mostly by nurses and women doctors, women nurses, that we have a stakehold in this Safe Hospital campaign because of this gender issue. That I think that statement should be there. That to maintain a hospital safe, who runs the hospital? Women, caregivers, and all that. And this gender issue must be there. Thank you.
Okay. Can you just put up the questions?
Okay. But with regards some question, I wasn't able to follow some questions. But talking about policies in the department, mostly the leaders, especially in the middle group like me, are all women. So even in my office, we are 90% women. Yeah. So we're ordering the men, no? Okay. So what I'm trying to say is this gender sensitivity thing is for us is not really an issue for us, no? Especially in the difficult areas, especially in Mindanao. Remember, in Mindanao, the people also running the hospitals are also Muslims. My coordinators in Mindanao are also Muslims. So they go to our hospital. I don't know if you have some experience, but in my experience, it's not a problem in health. I don't know in some areas, but in health, they treat people. We have also some stories that the health personnel from Cotabato Regional Hospital are being asked to go to the mountains to cure those who are deceased or those who have wounds secondary, and they go. They give services. So I don't know if this is really a problem. Now, in some evacuation centers, and we started this in Bicol also, there is an area where we put all the women in one evacuation center. Like, for example, all those breastfeeding should be in one area. So just to give sensitivity to the women, because if you are breastfeeding children, you have, you should have a certain kind of environment that will promote breastfeeding. Now, cultural sensitivity, we always include this in our policies or plan, and we don't see any problem with this because we respect the cultural, diversities of people in the Philippines. So I don't see this as an issue in disaster. For safe hospitals, I would be very frank with you that when we are thinking of hospital safety, we haven't thought of, because we don't see any way that this could be a sensitive issue in hospital setting. Because, like for example, obstetrics group is a different group from the other. We also have a hospital-based women's desk, which caters to problems of women, especially for those who are in this area.